Good morning, everybody, and welcome to our Quality Leader session. We are very happy you're able to join us. And for those of you that are not able to join us but are watching our archive, please know that our contact information is at the back of the presentation, but we're all available to help if you have any questions. This week, we are very excited and have the distinct pleasure to have one of our participants from the Leadership Academy join us to talk about their experience and share some of the best practices that we have. We've been talking the last several sessions and promoting this great opportunity. This is the first of a three-part series around understanding the Leadership Academy work that we have, which is a new nursing home high-value business model. The focus is really looking at low-burden, high-impact strategies that can be implemented to help organizations navigate and workforce stabilization. As we look ahead to
I'm sorry, Alyssa, I can't hear you anymore.
oh no, maybe if I talk louder, can you hear me now?
Now I can, yeah.
Oh, perfect. I'll talk a little louder then. Thank you. So the Leadership Academy was initiated in fall of 2022, when the theory was that we were looking to see what best practice opportunities existed in creating a nursing home model to work on workforce stabilization. The work group focused on a pilot program in 3 phases. Our first phase was to conduct information and interviews to understand what best practices existed. Our phase 2 involved inviting 12 nursing home leaders, or nursing home buildings with their directors of nursing, their administrators, and regional and corporate support to join us in piloting the work on these business models. We are looking to expand this work into our second phase, covering 40 nursing homes. Again, similar structure of directors of nursing, administrators, and corporate individuals to test these business models and build out a change packet. The work that's conducted with all of our participants will create the best practice change packet information that will be shared with all nursing homes across South Carolina with the goal of impacting workforce retention and workforce stabilization of our frontline staff. This pilot program was funded through the American Rescue Plan Act of 2021, the ARPA funds, under the Nursing Home and Long-Term Care Facility Strike Team and Infrastructure Project. It's managed by the Centers for Disease Control, and it was awarded to South Carolina DHIC. We were able to write for and receive the award to conduct this amazing work. Before we continue, let's share a short video on the Leadership Academy. As noted in our video and our conversation, the work is really spread over 3 phases, allowing us to really understand these best practices, develop the model using our quality assurance processes through a PDSA cycle, understanding what changes may need to be modified into the approach, and then spreading that out into a larger model before releasing the information for all of South Carolina facilities. We're very excited about the work that we've been able to do and the partnerships we've been able to build, and look forward to launching this work into phase 3 with your help. But as we look to today, there are opportunities that we can discuss the best practices and the learning tips that we've learned along this journey that can help organizations stabilize their workforce before phase 3 even begins. The low burden, high value bundle of best practice interventions center around 3 columns or 3 buckets, if you will: management practices, financial investments, and HR practices. In management practices, we're looking at the presence and communication. This may be rounding with our team members, checking in on people, doing regular town hall or community meetings, and hands-on leaders pitching in along with our frontline staff. Inclusion is an important component of management practices. CNAs or nursing assistants involved in care plan meetings, involved with frontline nurses in QI initiatives and helping to work on opportunities that we have. All staff involved in improvements and community building efforts. And in community building, we're looking at health and wellness, relationship building, and bringing the fun back to what we do. It's been challenging with COVID. We've worked really hard to ensure the safety of all of our residents, our staff, and our families. It's time that we move through this in this post-pandemic world of being able to contain and manage those infection control practices, but also include the fun into what we do. Under financial investments, this bucket includes areas such as wages and benefits, morale building, and work environment. When we look into this, these items do require financial investment and budgeting as appropriate. We want to ensure that staff are paid enough to live on and have a solid wage. That we provide affordable health insurance. And we're giving them the opportunity for PTO and time away to have that rebuilding with their families and their friends. Morale building looks at rewarding core staff, investing in fun, community building, and relationship building activities within our departments. And from a work environment, we want to ensure that we're taking care of our employees. We want to have staff, they have what they need, their supplies that they need to do a good job, that they have an employee break room, they have work areas and equipment, and appropriate staffing levels. And HR practices, another important bucket to help stabilize these initiatives. We're looking at how we bring new team members on board, how we incentivize stability and growth, and how we personalize scheduling. Bringing in new team members can be how we look at recruiting, screening, and hiring for character and values, including staff in the process and helping new staff settle in. Incentivizing stability and growth can include referring and retaining of friend programs, bonuses for reliability and a job well done, and tuition for basic and professional education. Looking at personalized scheduling can be involving scheduling so people can come to work, covering for each other when life events happen, and find out what's going on, and working collaboratively to support these programs and the needs of the organization. Much of our focus really comes from Don Berwick. Don Berwick is a quality improvement champion and was the CEO of the Institute for Healthcare Improvement. He was also tapped to work in, I believe, President Obama's cabinet with CMS work. Don Berwick is quoted as saying, "If you can't change something big, change something small." The foundation of what we look at, we're looking at the low burden but high impact strategies that make a difference. Our coaching sessions that we implemented through phase 2 and phase 3 support our pilot facilities and help us to work through these best practices and identify what areas of opportunity we need to improve upon. We're looking at implementing new high involvement management practices and ensuring that we're spending the appropriate focus and resources on frontline staff retention and high performance. We're collaborating with our corporate leadership to pilot new compensation and human resource practices, evaluating the impact of these practices so that we can determine which opportunities provide us with the greatest value in our work moving forward. And using the low burden, high benefit discovery and implementation assignments to move this forward. With that, I would like to welcome Jai Caddell of PruittHealth Moncks Corner as one of our pilot facilities in phase 2. Jay has some amazing experiences that his facility was able to implement, and we're hoping that he's able to share those with us today. One of the top practices that had a significant impact was the Adopt a Nurse program. Jay, welcome to Quality Leader Session. Thank you for joining us.
Hi, thank you, Alyssa. Appreciate you all for what you do in Constellation, for just keeping an eye, helping us out. Also appreciate the opportunity to participate in this program. It was a great experience. And we're talking about retention. In the pilot program, each facility participating kind of identifies what their specific set of challenges are, and then they build a cluster, a plan, to try to work through and strategize to address those issues. It's a really great program. I enjoyed working with Kathy and David and Barbara. They were very hands-on and very accessible when it was during the coaching times, and it was just a great interaction and some great ideas. But in our facility, we found that we had, of course, issues with retention, and there were some HR issues happening. There were some cultural issues that were just dissonant, if you will, a lot of siloing and sort of like a choir that hadn't practiced much, right? Just kind of not working well together as a team. And so we were working to try to develop harmony among the team. And it started with our leadership team, our management team, in the morning meetings, just helping them understand what is our philosophy, what are we going to be working on together. I'm convinced that no person can do it alone. We have to have a team and we have to work together to set things in motion. And so setting some expectations for leadership, and then some of the things that we did as a result of identifying that as an issue, building harmony into our management team. Some of the projects and ideas we came up with to help with that were really, really helpful. And one of them was during Nurses Week, we adopt a nurse from our management team. So we came up with that idea. All of our managers in the department head meeting adopted a nurse from the list of all the nurses that we had. And then I had also created a interest inventory for all staff when they come on, so we can kind of ask a series of questions. What's your favorite color, your favorite gift, this, that, and the third, a lot of different questions. And then we had that as a reference manual, so that if we pick this particular person, we could go to their interest profile, and you wouldn't, like, for example, you wouldn't want to pick flowers when someone's allergic to flowers, or has a different interest. So we were able to tailor our gift giving towards what they were specifically interested in. It just made it a richer experience. And then to have our management team buy in. We intentionally did not set any parameters on it, because we just wanted to see how creative and how what kind of turnout we would have. And everybody really had a good time with it. On the giving end and on the receiving end, we had one person that was reluctant to participate. But after a conversation, she jumped in and wanted to do it too. So, but the philosophy is, people don't leave us. They don't leave this for that. You'll see my quote. They don't leave this for that until they determine that that is better than this. We won't leave one thing for another unless we find better value in something else. So the idea behind retention is to build value internally within your culture that causes people to stay. And it's interesting, this is not in the slides, but AHCA just put out results of an analysis. I received an email this morning, and it says nationwide 94% of nursing homes are not meeting staffing requirements. And so we're not going to recruit our way out of this, because the supply is just not there. The answer to our staffing challenges is to retain them. And we have to look at our management styles. We have to look at all kinds of things to see how we can meet more of the employees' needs than just their paycheck in order to retain them. Because we, of course, can't compete on those levels on just salary alone and expect that we're going to retain somebody. If you can advance to the next slide, I'll proceed. Thank you. So that was the get to know me process, reconnecting with staff, identifying their needs. And so with that, we also, the DHS and I also began meeting with day 2 orientation with all of our new recruits and having lunch with them And we specifically just had no agenda. We just sat down and talked and got to know them. And that's one tool that's really kind of helped improve our retention rate. Just getting to know somebody, letting them know they have a resource, they have somebody they can reach out to, they have their phone number, their name, and you hand them these tools on day 2 of orientation so that if they ever get in a pinch and need help, they can just reach out and call. And identifying their needs, reconnecting with them. That was the whole philosophy behind the management team, getting them reconnected with our staff and reacquainted with them. So that was a great process. And then if you could go to the next one, please. Oh, that's it. That's it for me. Any questions?
Jay, you brought up so many amazing opportunities. And maybe we could take some time to dig into that a little bit further. Thinking about how you engage your management team and your leadership team. I heard you talk about bringing that into the daily stand-up meetings. How did you do that?
Just talking with them every morning about the importance of reconnecting. Another thing that we came up with was handwritten thank you cards. We just keep a big stack of blank ones on the conference room table, and anytime somebody says anything good about an employee, we just pass around the card and say, all right, everybody fill out a handwritten note for this employee, and then we take them up and we mail them to their home address. And so it's just a little different tweak on saying thank you, handwritten note, and just a way to try to reach them and retain them. You know, we all have rough days, especially when we're short staffed, and it's a challenge. We have more work than we can do on any given day, and that's anybody in the facility. So getting help with yours is not going to be easy because everybody else is overtasked as well. So it's just a encouragement when you're spent at the end of the day and you go home and you check your mail and there's a thank you, you know, or a stack of them. So
I could imagine that would be something special to receive. I mean, most of us receive bills or newsletter type information in the mailbox, but we hardly ever receive cards anymore. So that would make a big difference.
Another thing we did, just to, again, the idea is to meet more needs than just a salary, as we said. Try to meet their emotional needs, their connecting needs. If they have any kind of crisis in their family, we have an internal fund that we created that we do fundraising every pay period that we have to maintain to help support if something bad happens. You know, we have a community board posted in our service hallway that we call it our barter board. So that if anybody has a dog for sale or a sofa or, you know, or has a need for those things, we can post our internal classified ads and we can help support each other. And so it's just about creating community, as you said, and just a sense of belonging. And it's really, so results, fast forward, when I first came to this facility, we were at over 100% for 90-day turnover, look back. And the last read I got was we were down to 13%. So it is effective. And I would encourage any other facility to participate in this program because it really gives you a support team to help you navigate the challenges that you currently face. So it's practically applicable, not just in theory. They go along the course of time with you and they discuss every time you meet a challenge, and you get ideas and you implement things at trial and error, and they just really have a lot of years of expertise behind them. And so it's a really great opportunity. I would encourage anyone to jump in.
I'm sorry, Alyssa, go ahead.
No, thank you for sharing your experience working with the consultants. I can imagine that having that level of knowledge available to you and to talk about different programs, it would be very beneficial.
Agree. Deneen has commented that connecting with staff on that personal level really is wonderful.
With the get to know me process that you were talking about in the Adopt a Nurse program, was that Adopt a Nurse program over a specific period of time? Is it did you highlight certain dates or certain events that would be important to include for that person?
Actually, since we were just piloting the idea, we just did it for the nurse week. But we have entertained the idea of making it more of a long-term adoption, right? And so that way you get to know birthdays and anniversaries and things and celebrate. So, but we're contemplating extending that, sort of like the, I don't know, the secret pal idea, sort of, but we just wanted to do it for that point. And the idea was, yeah, it was good for the nurses to have a good outcome, but the main idea was really to re-engage the management team in the operation. And I think that's where we really made some strides.
Wow, what a great opportunity. And it changes that celebration week, makes it more, to your point, more personalized. It's a great idea.
Right.
I could imagine for some of the other organizations that are maybe challenged with other departments or other areas, that it may be a great opportunity for their celebration week to do that, to adopt a staff member and just have that engagement, that broader engagement with those team members as well.
From the Congress that we attended yesterday, where the facilities came together, I also heard an idea about where one facility just took they call it the woot wagon. I don't we can be as creative as you want, but they would go around with snacks and drinks and that they had purchased, and just have like a powwow running through the facility, passing out snacks and drinks spontaneously. And I think that also is a good idea. We were thinking, I don't know if I would name it that, but we're going to maybe implement that as well, as just a spontaneous, hey, take a quick break. I know it's tough, but we're here with you, trying to support. And so anything we can do. And so the bottom line, it doesn't matter how much we appreciate our staff if they don't know it, right? And we know that everything that we do relies on direct care staff, and that's the area where we have the biggest opportunity. But we could just be madly in love with them, but if they don't know how much we appreciate them, and we don't communicate that. So it's really about identifying what is the best delivery vehicle for our message, that we care about you, right? And that's, I think, that in a nutshell, the root of how we retain people. We connect with them and we demonstrate to them in deed, not just in word, how much we appreciate them and what is their value.
Yeah.
Shelley says that they run the woot woot wagon through her daughter's middle school classes. And that it's quite the hit, apparently.
What a great idea, and very low burden.
They even mentioned that one of the facilities mentioned that they assign it to a different department every week to do it. And so some will decorate it in a sports theme, and so there's a lot of creativity that you can engage your management team as well. So just some really good ideas, but we got to get to the root of solving this crisis and navigating this crisis. With that many facilities nationwide, 94% not meeting our staffing requirements, that's staggering.
Yeah. Definitely, yeah, it makes you stop and think, doesn't it? And, and most importantly, we recognize how much we contribute to our communities, how much our families rely on us to be part of our community, and that they can have those important relationships maintained without the burden of having to travel long distances. I agree with you. It's so important that we're talking about this and working together as a community of or an industry to support the improvement across the entire industry.
Right. And I don't care whose idea it is. If you steal it and you use it and it works for you, I'm happy.
I think that's the foundation of quality improvement. Beg, borrow, and steal.
That's right. But it indeed has been a pleasure working with this pilot program. And again, I would recommend, because whatever challenges, there may be facilities who don't struggle as much with staffing and they have other issues. you can really throw it on the mercy of the court, so to speak, and they'll jump in and help you navigate those and come to solution. And I think that's a great opportunity. It didn't cost anything.
That's right. And it's very true. One of the things that Jay is talking about is the Outcomes Congress. And so yesterday, Beth and the team led a meeting with all of our phase 2 participants to talk about the best practices, to talk about the lessons that were learned, and enjoy some fellowship. It was a great opportunity to connect face to face with some of our other organizations and meet each other in person again. Another good positive step coming in a post-pandemic world. And so there was a good opportunity to share those best practices that the organizations are using and understand that the program really is about meeting each building or each organization where they're at and then building from there so that it keeps that focus on the low burden initiatives. It keeps it manageable with everything else that's going on that's so important. Jay, if we were to ask you again, would you come back for phase 3 and join us again for additional work?
Absolutely. In fact, I think they've invited me to participate in phase 3, and I'm excited about that. But yes, I would highly recommend it. Just a great opportunity to get some extra help.
Wonderful. Is there anything else that you can think of that a nursing facility or a leader who may be contemplating this should think about as they're looking forward to this opportunity?
I do. I think that it's time to really just kind of put it all on the table. And this is a very non-threatening group. It's non-judgmental. If you're struggling with issues, it's no shame to put it on the table and let the whole group collaborate on giving you ideas. I mean, that's only going to advance your initiative to be in a better position. If it's a quality metric you're trying to drive, or if it's profitability, or whatever the issue is, there's nothing wrong with accepting free help. And it may be that you do something good, but you can do it great if you have some extra support. So maybe there's not an area where you feel like you're struggling. I find that hard to believe, but looking at the data, but there's always an area to improve, and it's just a great opportunity to jump in and do that and launch your facility forward. I think a retention rate or a turnover rate of 100% going down to 13% is nothing to shake a stick at. I think it's a reason enough to participate, and so it's nothing wrong with getting help. And these folks are just really just in your corner, and you get a sense of that when you're going through the process with them. Like you have a support, and it's not a corporate person who's trying to support you in the ways that interest the bottom line, right? It's somebody who wants to see genuine success and improvement. So jump in if you can. We need 40, right?
We need 40.
Yeah.
That's such a powerful statement. And, I'm not sure about you, Jay. I've been an administrator 15, 16 years. And it's okay to say this is probably the hardest and the most challenging time to be an administrator and to be leading an organization, coming through a pandemic, coming out of the pandemic, and still trying to hold those best practices forward, but getting back to what we do. And I'm sure we're all at different levels and what that return to normalcy looks like in our organizations. But there's nothing wrong with recognizing that this is hard and people are doing an amazing job. So to be able to your point, have another set of eyes come in and help, or another set of ears come in to help generate some ideas in a very non-threatening manner, sounds like a fantastic opportunity.
Right. During our proposal of writing the cards with the management team, I had one particular staff member that was very reluctant to participate. And we did it a couple of times, and I noticed that he didn't fill out a card. And so I brought that back to our coaches, and I said, they asked me how it was going. I said, well, we got, pretty much adoption, but there's one person that's not really in. And it was a clever response from them. They said, well, why don't you send him a card? And here I was like, I want to write him up. He's not listening to me. He's not, so it was just a different spin on, of course I did that. And then every other time after that, he's writing cards with everybody else. So sometimes it's just perspective. And, whenever we look at a peer group, we're talking about people who are in the trenches with us. But these coaches, they're obviously not administrators currently. And so they have a different perspective where they can objectively give input. And sometimes that's valuable. But that I just can't say enough about how Kathy and David and Barbara supported us and really just made us feel like what we were doing was worthwhile. They brought so much expertise to the table, and we appreciate that.
Sounds amazing. Thank you so much. I'd like to ask, does anyone have any additional questions or thoughts?
Everybody seemed to be really, really impressed by the 100% to 13%. But we don't have anything in chat. You can feel free to take it off mute and ask out loud if you have something. I know I've worked in a couple of organizations where they did the management thank you cards, because it was the management that wrote the cards. And they really said, thank you for doing this work, not just because it's your job, but because you do it with heart, with you want it to be done, you want it to be right. And it really does make you feel good to get those cards in the mail.
I agree. I don't know what I just did to my screen, but I can't see you anymore. But I agree. And I just told my management team this morning that, we have to become students. This is a different workspace. It's not the same as it was years ago. And if we're looking at our rearview mirror, trying to re-emulate what we saw before, it's just a different time, a different era, different sets of problems, and I encourage them to become students of what we're doing again, and to be nosy and snooping and in people's business, trying to find problems that we can solve and needs that we can meet with our staff members. I'll give you a quick example. If we have time, I have a housekeeping person that he was sick a couple weeks ago, and wasn't able to go see his brother up north, I think Delaware, who was also sick. And so while he was recovering, his brother passed away, unfortunately. And so he was struggling with that because he wasn't able to go visit him. And so I said, well, you got to go to the funeral. He didn't want to go. He didn't feel like I had the money. And, so I said, why don't I just fly you up there? So I went and purchased a flight for him to fly up there to the funeral. And then he indicated that he had never flown before, and he was very nervous, right, about flying. I said, well, you know what? I'll just fly up there with you. So now we have a booked flight for next Saturday to go to Delaware to take him to his funeral, he and I. So, it's all about just identifying those needs that we can meet and then trying to do that.
Deneen
Really special.
Deneen has said that she worked at a hospital that did all these things. And at the time, she didn't give it much thought, but it was really, really nice. And hearing you talk about it makes her appreciate it more. And I know that a lot of those things were things that in the hospital they initiated when we were being studerized, when they were working on, hardwiring excellence. And they talked about a lot of the things that have been brought up here. And they also talked about leadership rounding, where they actually sat down and had a conversation with the frontline staff and determined, do you have what you need to do your job? And what would make it easier? Is it that, and one lady said something that was really interesting. And she said, it would make my life easier if I had cleaning supplies on this end of the hall. She said, because all the cleaning supplies are kept down there at the nurse's station. And that was something that was very simple. It didn't cost a penny to do it, but it made the staff's life so much easier. And they were so much happier because then they didn't have to traipse all over the building and double their steps. So I do appreciate the work that's going on and what's being done to be cognizant of the challenges they face.
That's a great point, Chris. So many things to think about that are so really in the level of burden, are really low burden, to coin the term for the project. It's not excessive amounts of time or resources. It's just having a listening ear and a caring heart, and being creative and developing those solutions. It's just, thank you, Jay, for joining us today. You've really brought about a lot of thought-provoking ideas on how we can really implement not just the steps, but the thoughts, the theory behind how to think about things a little differently. It's been an absolute joy and pleasure to have you with us.
Thank you.
Yes.
And we'll see
For
what phase
those
3 brings. I'm excited to see what we're going to do next.
Absolutely. Absolutely. If you have any questions or thoughts, Beth Hersher is the program manager for this entire project. Her contact information is listed on the slide on the screen, bhersher@constellationqh.org. If you do have any other questions and can't remember or can't find access to Beth, feel free to let Chris or I know. We're happy to do so. This session is available on our archive, and we do hope that you will share this with any other organizations that you know of that may be interested in joining with us. Thank you so much for your time today, and not seeing any further questions or comments, we're going to close our recording and wish you a fantastic weekend. Thank you, everybody, for joining.
Yes, thank you.